Hi and welcome. My name is Natasha Chen, and I'm a graduate student at the University of Massachusetts at Dartmouth. I would like to thank you for the opportunity to present my research on adolescent resilience. Resilience, as a concept, was introduced in the psychiatric literature in the 1970s to describe a child's ability to adapt to an abusive situation and then expand this adaptation to any other adverse event. This concept was generalized to then encompass the individual at any age's ability to adapt to adverse events. Currently, the term resilience is being closely linked to the world's response to the pandemic of COVID-19, illustrating how well people are adapting to the physical distancing and the new way in which people are working, educating, and interacting with each other. It is my assertion that resilience differs by age and is impacted by the individual's coping, self-awareness, mindfulness, and bounce back. These attributes of resilience are defined as follows: coping, how the individual responds to a stressor; self-awareness, knowledge related to adversity; mindfulness, the adaptive ability of an individual when faced with adversity; and bounce back, the patient's perception of returning to normalcy. As an individual develops these attributes, the individual gains or increases his or her resilience. In examining the case study of JD is a 15-year-old male who has recently been diagnosed with type 1 diabetes. Prior to his diagnosis, JD was the quarterback on the high school football team and was a model student academically. Because of hospitalizations and multiple visits to the diabetes clinic, JD fell behind in his schoolwork and had to sit out the end of the football season. JD's parents were not able to attend his physician and clinics appointments as his nurses would expect, but JD was able to attend educational programs for adolescents with diabetes and was surprised to find the number of patients with similar goals and interests. Over the course of the year, JD was able to maintain his HbA1c levels at less than 9.0 and learn the skills to manage his diabetes and meal planning for himself. With this, JD demonstrates coping and self-awareness, though his parents were not able to be involved as rigorously as the nurses and educators might like. JD developed the skills necessary to independently care for his diabetes. The subsequent fall, JD was able to return to sports, resuming his position as the quarterback of the football team and resuming his academic performance. JD learned that he would need to pack snacks and meals. He was also able to teach his peers to be aware of the signs and symptoms of hypoglycemia and what to do for his care. JD is now demonstrating mindfulness and bounce back in his return to academics and athletic performance. Due to his increased self-awareness, JD then increases his resilience by empowering his peers on his behalf. The relative importance of each of these attributes differs by Erikson's developmental stages. Where children rely on their parents and family for coping, the adolescent relies on his peers and role models to gain self-awareness and independence. This becomes more clearly illustrated by Hillard in 2017 with the development of two distinct tools to measure resilience in type 1 diabetic patients. He first looks at the tools that were implemented for resilience in type 1 diabetes by Hood, Miller, and Rausch for children and has noticed that the adaptation was required in order to more accurately model the resilience by the adolescent age group. In 2017, a tool was developed known as D-Star Teen to more accurately reflect the adolescent's need for autonomy, functional development, and spending time away from his family and home. It is the development of mindfulness and the increasing self-awareness of the adolescent that increases positive resilience in adolescence. JD exemplifies the positive resilience by being able to successfully complete his high school and return to sports, while being able to manage his type 1 diabetes independently, meeting the physiological parameters set by the researchers in D-Star Teen. The differentiation and weight of attributes relevant to resilience is exemplified and demonstrates the need that resilience is examined as it is related to developmental stages. In increasing the tools for measurement of resilience, the researcher needs to identify his or her population by developmental stage and clearly account for the disparities between these stages. Thank you very much for your time and effort. Have a great day.